they have an ileostomy bag? So interesting question, and the answer is it's difficult. The ileostomy is basically your bowel has been your ileum, your has been exteriorized out through your abdominal wall, and so you have a connection of your bowel to the abdominal wall. So the answer is that you'd have to be very, we would have to be very careful with it. And I wouldn't say it's an absolute contraindication. I wouldn't say it's a definite no, but I would say it's something that needs definite, careful consideration. We need to examine you. We need to see where that ileostomy is. If the ileostomy is quite low in your abdomen, um, obviously we wouldn't want to be messing with the ileostomy. We wouldn't really want to be sort of reciting that ileostomy. We probably want to really, ideally, leave the ileostomy where it is. So we'd be looking at taking the tissue below the ileostomy. Depends on how much tissue is there. If there's a lot of tissue there, and if you've got a significant apron, so if you look at the side view, if there's a big apron, big sort of hanging down, and the ileostomy sort of above there, then we could do what's called an apronectomy, which is sort of like a tummy tuck, and you can sometimes people use the term interchangeably. But an apronectomy is more for someone who has got a significant abdominal apron, and you basically sort of amputate the apron. You just take off like a melon slice of tissue. You don't really do any undermining. You may or may not have the belly button in that apron, and sometimes you just say, look, the belly button's going to go. It's really for someone who's got a significant abdominal pannus, or a sort of overhang, and it's sort of less of a cosmetic operation, really. It's more of a functional operation of a significant pannus that's just sort of getting in the way, and difficult toileting, difficult with mobility and things like that. So that is sort of what I'm thinking, because you don't really want to be doing any extensive undermining, because you don't want to be undermining and then suddenly find the ileostomy there, and perisys or risk damaging that, because that could sort of damage bowel. So when we do a tummy tuck, we don't normally go anywhere near bowel, because we're sort of superficial to the abdominal wall, and all the bowel contents is normally deep to that. But when you have an ileostomy, it's sort of poking through. So we don't really want to see that. We don't really want to go anywhere near the ileostomy. So we would have to have a careful consideration. We'd have to examine you and make a judgment on that. And so I wouldn't like to say definitely yes. I wouldn't like to say definitely no. I'm sort of probably leaning more towards a no than a yes, to be honest with you, because you don't really, if you start damaging bowel, that can have significant consequences. But it depends on how much you're troubled by it, as to whether it's worth taking on the risk of surgery. And if you really are troubled by it and you want to consider surgery, it's something we could consider, assess, and examine you and see if it would be possible to maybe take off, just a wedge of tissue, and close it up, and make you feel more comfortable, although it wouldn't be quite the same as a cosmetic tummy tuck. So if you look at photos of cosmetic tummy tucks, it might not be the same sort of result. So really, really reserved for people who have got, can you hear them in the background, have got a significant um, excess and a high ileostomy.